Hey y'all, Ben Hall back here at Catto&Catto. Welcome to how we're doing things this year. A lot of Zoom meetings, given everything that goes on in the world since about March timeframe. So it's been a strange year for us, and I know that it has been for y'all. So let's talk about insurance. It's my favorite topic. I know it's not yours. So we're going to spend, I don't know, 15 minutes or so on this webinar. When I look this direction, I'm going to be looking at this screen and just scrolling through stuff. Big picture, little picture is this. Big picture is we stayed with all the same carriers. The prices on Blue Cross, Blue Shield for the same plans went up a little bit. That was driven primarily by how much we're using the plan. It was still the best decision, absolutely the best decision, to stay with Blue Cross Blue Shield. They drove the best deal for us. But we are using this plan, so that's good. Cost only went up a couple of percentage points, just depending on the plan, but we still have the middle plan is almost below the $450 defined contribution. The lowest plan is still below the defined contribution, and then the high plan, it was always above that. So everything else, dental, vision, everything else, we stayed with the same carrier, which is Principal, and the prices stayed the same. So this is open enrollment. You're going to fill out this page that you've all seen before and turn it back into Michelle. She'll turn it into us, and we'll turn it into Blue Cross Blue Shield. How about that? So you'll check. This is open enrollment. This is the time where you can make any change you want. Outside of enrollment, you have to have what's called a qualifying life event: marriage, divorce, birth of a baby, things like that. Those are reasons the IRS says you can change your election during open enrollment. You'll fill in the stuff that you know. These dependents, that's for your life insurance. It's got to go somewhere. Medical plans, you'll say yes or no. These are all the costs. I'm going to flip over in just a second, and I'll be scrolling through a ton of information in the enrollment guide that y'all are used to seeing. So on these two of these three plans, they're called gatekeeper-based plans. That didn't change from last year. It just means, and we've highlighted it, you have to, PCP, primary care physician, got to anoint a primary care physician when you enroll. The high plan, you do not need to do that. You've got your dental options here, your vision options, life insurance, and you've got it A, D, and D. That's for spouse and children. Sorry, I was reading it. I'm like, why do we have that listed twice? But one is for you, the other is for spouse and kiddos. And then you've got your beneficiaries for life insurance as well. I'm going to flip to this page. Here's what I just scrolled over, your benefits guide there for 2021. This page we already covered. These are the same plans. So we've got the least expensive option is an HSA. Everything goes towards to the deductible. So you have a $100,000 bill. And I know there are some of those out there because we've seen the claim reports. It doesn't say who the claimant is, but it says just the dollar value. So some people are actually using this stuff, and they'll go into the hospital and it'll be a $100,000 bill. Well, as long as the hospital's in network for covered services, you're done. I'm highlighting these numbers. You're done at $5,000. You can arrange a payment plan for that. The only thing that's on a copay, all a copay is a flat rate when you use something, is virtual visits, which is good considering, you know, the zombie apocalypse that we're in the middle of right now. So you've got a copay for virtual visits, and then everything else is just the discounted cost of staying in the network. But all of that goes towards your deductible and your out-of-pocket maximum. The mid plan is a little more expensive because you're paying copays 30 and 60 when you go see a primary care specialist. You're paying copays. There is that difference between preferred and non-preferred. Preferred is just at a prescription place that Blue Cross tells you to go to. Let me see if we can source that for you here. Don't go to CVS. That's not new. It's like Walgreens is one of the places. Brookshire's HEB are those preferred pharmacies. and the non-preferred is anywhere else. So it's just where you buy the drug. Again, that's not a new feature. You've got a $2,000 deductible, so that's the money that you pay first, and then worst case scenario is $4,000. So you got a little less exposure on the mid plan than on the base plan. High plan is the most expensive, honestly, because it has the lowest out-of-pocket maximum. So that has the lowest risk to you, therefore the premium is going to be the highest. Copays for prescriptions are the same as they are on the mid plan. The deductible, this is kind of squirrely, the deductible is actually higher, but the total out-of-pocket maximum is lower. And then you got $10 less on a copay for a specialist visit. Other than that, those plans are fairly similar. I believe we said this earlier, defined contribution, city still pays $450. So if you're buying something that is less than that, the difference goes into your HSA account, which is pretty cool. But you got $450 you can spend on anything you want. Prices are all right here, low, mid, and high, and those are the prices that went up approximately 7% over last year. And again, that was the best deal based on how much we're using the plan. This is the HSA account. It's called Benefit Wallet. This is where the money goes. You can also put your own dollars into this account for medical or dental or vision. You can put different amounts depending on how many people you enroll, 3,600 or 7,200. And then if you're over 55, you can add $1,000 to that. This just in, this was new in like the 70s, I think. Call 911 if there's an emergency. Not sure y'all knew anything about that. But just in case you didn't, it's there. We include this slide really to highlight the difference between these bottom three: urgent care versus freestanding ER, hospital emergency room. I think most of you are going to know this just by virtue of your job, but urgent care providers are all over the place. You can't throw a stone and not hit an urgent care provider. Freestanding ER is going to be a big old bill, and it's outside of a hospital setting. So it's an emergency room, not in a hospital. And sometimes developers are putting an urgent care in the same building as a freestanding ER. And if you walk through the wrong door, you're going to get a big old bill. And unless it's life or limb threatening, they're not going to see you very quickly in an emergency room unless it's life or limb threatening anyways. So be aware of that. Let's talk about your teeth here. Principal plan is the same. Price is the same as it was last year. Network's the same. Same. No matter which plan you choose, you get $1,500 that Principal is throwing at your mouth. So you got $1,500 you can use to apply towards services. Any way you go, those preventative services, those are your twice a year annual teeth cleanings and some of the x-rays associated with that. That's a freebie. It's covered by the premium coming out of your paycheck. But if you have stuff that you need in addition to that, that's when those services apply against, the dollar value of those services apply against this $1,500 maximum on either plan. And really the biggest difference between these two plans, honestly, is this line right here. Whoa. See that gray bar, out of network reimbursement? You'd be better served to go on the plus plan, flex option 2. You see they're the same cost, right? But if you are going to an out of network doctor, meaning they're not inside the Principal network, then flex plan option 2 is probably going to be better for you. It will likely result in lower out of pocket costs to you. If you're going to somewhere that is in network, inside the Principal network, then pick the value plan. It basically just means if you're going out of network, they've got to benchmark it, and your net cost is going to be lower. Whereas if you're on the value plan and you go out of network, your net out-of-pocket cost is going to be higher. So it's just a function of who's in and who's out of the network. Benefits are really, really similar. Vision, you go in, you fork over $10, and then they give you 130. Give you 130 for some frames, and then you get a percentage off the balance that is exceeding 130. Or you can get $130 for contact lenses. Either or, not both and. So that's what this once every means. It means either glasses and frames or contact lenses, not both at the same time. If you're like me and you have to sneeze right at this moment, then good. COVID free, no, just had to sneeze. There were some dust bunnies in my office. But these copays for these lenses, I could not get out for $10 copay because I've got to shrink the lenses down just to be so thin, and that's not covered by the copay, and that's driven by how blind I am. So just be aware of that reality. But you get either or, and the costs are below. The network is right here that I'm highlighting. Costco, Vision Works, Texas State Optical, places like that. And the prices are the same as they were last year. This is the life insurance. So when you're on that enrollment form and you're filling out the beneficiaries, this is the line of coverage that is attached to. And I think, just as I'm thinking about it, I may have said on the enrollment form, which is right here, I'll scroll back to it, I may have referred to these as beneficiaries. These are not beneficiaries. These are your dependents. So spouses and kids. Basic life is $50,000. That's free to you. Spouse and kiddo, 43 cents per pay period. You've got 3 plans through Aflac. Kat is the woman to call if you have any questions. But you've got 3 plans: accident, cancer, and hospital indemnity. Accident, get hurt or sick, seek treatment, and it wasn't on purpose, that's an accident. Money comes to your mailbox depending on the severity of the injury. Cancer, the one that the word nobody ever wants to hear. God forbid you receive a diagnosis. It pays a benefit to your mailbox if you are diagnosed, God forbid, with that disease. The hospital indemnity sends money to your mailbox if you go into the hospital and stay there for more than a day. So some folks like the hospital indemnity plan because you have a $5,000 deductible, a $2,000 deductible, and a $3,000 deductible. So some folks find some value in paying Aflac a little bit of premium for the right, if they go into the hospital, that Aflac sends them money to their mailbox and they can take the money out of the mailbox and pay the hospital or buy groceries or do whatever they want. Travel assist, more than 100 miles away if you're thinking about insurance, good on you. This is a squirrely one, but it's in there and it's free. If you're more than 100 miles away traveling, and it's like lost bags, getting you back to the United States if you can't get back. That is through AXA assistance. Premium only plan just means the money that you're paying for benefits is reduces your taxable income, which is a good thing. That means you don't pay tax on the money that you're buying on benefits. Okay, here's the part of the presentation. We're at page 11 out of 36, but we're like 5 minutes or less away from the end. A lot of material, just as a reminder, they have an app. Imagine that. Imagine that Blue Cross Blue Shield has an app. So you should download it. It's just fun. You see all sorts of things. Find in-network doctors, hospitals. Page I'm on right now are those preventative services on all 3 plans. You've got certain services that are paid for at 100% by the insurance company. That means you're paying 0, they're paying all. So we want you to have that listing for what it is. It's right here. This is just a different version of the app. Oop. Blue Cross Blue Shield of Texas /member. You'll find your account. It'll have a lot of the same information. And folks like it for this if they're in a complicated scenario and they need to see what the EOB or explanation of benefits says. You can find that online. Next couple pages are all about well on target. You can take a health assessment to see if they think you are as healthy as you think you are. How about that? You can take a health assessment and you get some points. You can use your points for some prizes. They've got a wellness portal there. Here's some instructions about how to use it. If you have any questions, there's some help desk there. Tools and tracking, health assessments, fitness trackers. And you get some points by enrolling, completing your health assessment, and syncing up a device just like this. What do you get for all that? Highlighted way too much. Terrell books, healthcare, personal jewelry, music, sporting goods. Look at that. A lot of Christmas presents right there. A lot of Christmas presents could be right there. So here's some points, and then there's the corresponding action items that would need to be completed. And guess what? They have an app too. Imagine that. Everybody's got an app. Look how much fun this guy's having exercising. You want to be just like him. He looks so happy. He's all synced up. He's ready to go. Got a can-do attitude. This woman is supposed to have a sick child. There is no way that child is sick because no parent is that happy when their child is sick. Just, you know, reading and writing that child is doing. I don't think so, because they are sick and they want to speak to a doctor or therapist anytime, anywhere, which means there's an issue. Powered by MD Live. This is the same vendor that we've had in the past. It's 24/7, 365. That's our virtual visit. No matter which plan you're on, it's on a copay. Here's all the stuff that it can handle. My highlighter is going a little wonky. Coronavirus and what it means. In case you didn't know, there is a worldwide pandemic going on as it relates to the coronavirus. There's some more information on it right here. GoodRx is a great non-insurance solution to finding potentially a less expensive medication. So they have an app. You can also just look on their website. It's going to look something like this. You'll type in your prescription, it'll bring up the cost and then the closest pharmacy. I like GoodRx. Again, it is not processed through your insurance, but it's a good thing to just double check when you're getting a script. And the rest of this information, you can just close your eyes. It's great late night reading material. These are required notices that we need to have in here, but we're not going to review them in depth just for the sake of time, and we'll end on this page. So give Michelle all of your forms. She'll give you a date for that, and then we'll turn them in. Justine in our office backs up Michelle, as do we. And glossary of terms, just in case you're sitting next to somebody at a Christmas function that you don't really like, you can say, you know, a pre-authorization is a decision by your insurer, plan or service, treatment plan, prescription, and they'll just get up and start walking away. If you start talking about insurance, I promise they will. I use it all the time. Now my secret's out because I spilled all my marbles in the lobby here. So anyway, I wish we were with you face to face, because we like our customers and we've been working with you all for a long time. So thanks for hanging on and listening to virtual presentations. If you have any questions, either now or throughout the year, please call us and let us know. We don't go anywhere here in the middle of the year. Right now, literally, we don't go anywhere. So let us know if there's a way that we can be helpful. Have a great rest of 2020 and a safe and prosperous 2021. Thanks, y'all.